Today I'm going to be discussing primary versus secondary delusions. Um, I haven't Googled those terms, so I don't know if those terms are um, terms that I've personally used to describe um, the various types of delusions and to categorize them, or whether they're actually um, known terms in the world of psychology. So I'm not going to claim to either have created them or to have gotten them from anywhere else. Anyway, the two terms that I like to use are either primary or secondary delusions. Primary delusions are delusions where the individual has a physical abnormality in the brain that causes that person to be delusional. That delusion that may result may be precipitated by the person's upbringing, but the cause of the delusion is based on an actual something going on in the brain itself. Um, there's usually not much that can be done at this stage to actually make the person not delusional. As far psychologically, it can be done in some cases chemically because delusions are in many cases or in some cases based on overactive receptors in the brain, such as dopamine or serotonin, which may cause excitement and overactivity in the brain, which can be sort of squelched with medications and thereby minimize or eliminate the delusions. Then there are secondary delusions, and those I find extremely fascinating. These are delusions that the individual uses to explain things in life. As human beings, we're hardwired to look at events around ourselves and to try and make sense of it. We have a hard time accepting the status quo without understanding the unifying theory or why things are the way they are. So, for example, an unrelated example, if the fish population were to be dying, the first thing we would do is try to figure out what is causing that to happen, and that's just human nature. It's not something that it's not a mental disability. It's actually it's just hardwired in our nature. Excuse me. Uh, Now, what happens is, as in the example I gave in the introductory video, you can have an individual who has a physical ailment where um, the pathway, as I explained briefly then, the pathway between the eyes and the brain are disrupted, but not disrupted optically, meaning the person is still able to absorb light into their eyes and view external objects and see them as they are, as an object. Um, the But because, as I explained, the eyes take light and messages and transfer them to the visual cortex of the brain. However, it also transmits it to the emotional part of the brain, so that the person can not only see the object they're seeing, they can also have an emotional reaction to it. And by an emotional reaction, that would mean the person would understand their relationship to that item, to that individual, or to that set of events that they're viewing. So, for example, if a person sees a plane crashing, something that was actually in the news just this Saturday with the Asiana jet crashing, one person can see that if a person does not have the emotional wiring to their visual or auditory nerve, they can actually just see the plane crash as crashing with absolutely no reaction to it. And that's why some killers or murderers or serial killers are actually devoid of emotion. They have no empathy because what they see, do, or whatever damage they do, it does not bypass the emotional part of the brain. And as a result, events are just events. There's no emotion behind it. There's no empathy. So somebody can see a plane crash and just see a plane crashing, blowing up. They can hear about people dying, people being injured, and it would mean absolutely nothing. That does not mean that they did not hear, see, and or understand the events. They just have no emotion about it. So the individual with there was an individual that I was discussing moments ago that had a delusion that every person in her life had been replaced by identical individuals who were not the people that they knew. For example, her mother, father, brother, friends, relatives, everybody was replaced by other people who looked exactly like them but were just not them. Now, that is a bizarre delusion. That's because that's not something that is generally accepted by society as something that is likely to happen in any circumstance. Now, the cause for that delusion was not a delusional disorder of the brain. The cause for that delusion was the individual at some point in their life developed a physical condition where the information absorbed by the eyes did not any longer bypass the empathetic part of the brain. They went directly to the visual cortex and exclusively to the visual cortex. As a result, the person who, until this this problem began to occur, would see her, for example, her mother, and feel that this is her mother, and know that that is her mother, and whatever she feels about her mother would come to mind and would be registered on a subconscious level. Once this disruption took place, the individual would simply see her mother and not have any emotional reaction to her mother on a conscious or subconscious level. As a result, the brain can either just see that occurring and realize maybe there's something wrong. Why am I seeing my mother, and why do I have no emotional or empathetic feeling toward her? That is one way of seeing things. However, this individual engaged the normal human reaction, which was to try and explain why it was that she was seeing her mother or someone who looked like her mother and not feeling that that is her mother. And the explanation that she came up with, or that her brain created, was that someone who looked just like her mother, who knew everything about her mother, who behaved like her mother, took over her mother's body and took over her mother's life, but was just not her mother. And she couldn't explain why. She would just tell therapists and doctors and others that she doesn't understand why, but she knows that that is not her mother. And the way they dissected this case was by neurologists and psychologists realizing that when she would speak with her mother on the phone, she would say, "Hi, Ma," and have a great conversation with her mother. And she would actually ask her mother where she was, and why she left her, and why she allowed these other identical looking people to take over her life. And she wanted her to come back. But then she would see her mother in real life and say, that's not her. She would and when what they realized was that um, the dual pathways between the auditory nerve and the visual nerve were not equally disrupted, meaning they were independent of each other. The auditory dual pathways were, one of them was disrupted, where there was no empathy, there was only visual registry, and auditorily there were, both pathways were intact. So when she would hear her mother, she would register the feelings she had about her mother, and when she would see her mother, she would have that feeling of, this looks just like my mother, but it's just not her. And that was the same feeling she would have about anyone she would see. Um, while anyone she would hear would make complete sense to her. So the delusion in this case was the attempt to explain life, to explain why and make sense of life. So when somebody is delusional, what in many cases they're doing when the delusion is secondary to the circumstance and is not the primary diagnosis or an actual abnormality of the brain, it's an attempt to explain life. So, for example, if somebody has a pain in their abdomen, so the first thing the brain wants to do is to explain it. It cannot just accept that pain. It needs to right away analyze that pain and figure out, oh, that was something I just ate. That was just an upset stomach from the Chinese takeout or whatever. It cannot just say, okay, my stomach hurts, and just move on. Now, if somebody's mother or father or relative or somebody close to them died from stomach cancer, and especially if in that case that person was not diagnosed until later because they had stomach pains that they told their doctor about, and the doctor didn't take them seriously, and that allowed the tumor to grow until the person was finally diagnosed after a long time, and then the person died from stomach cancer. So that person will explain that pain as likely being due to undiagnosed stomach cancer. Now, that is the brain's attempt to explain what's going on. That's step number one. Now, the way things advance into a delusion is that the person now needs to create a reality around the belief that they have stomach cancer. So they'll go to a doctor, and the doctor will tell them that we'll run a bunch of tests and hopefully say that they don't see anything, and it might just be some irritable bowel or something they ate that day or whatever it is. And the person will then go doctor shopping and and try to get a diagnosis. And as the doctors start just rolling their eyes and saying sorry, or raising their hands and saying they don't see anything, the person will begin to become entrapped in that belief that they have stomach cancer and that no doctor or diagnostic equipment is able to identify it. So that then advances into a delusion where the person believes that they have an illness that is otherwise unexplained, and that's called a somatic delusion. It used to be called neurosis, and after that hypochondriasis, where the person believes they have an illness and will go from doctor to doctor and do test after test to find what they already believe to be the diagnosis, but that nobody else is able to identify or definitively diagnose. So what happened was there was an event, the stomach pain. There was the explanation that the brain jumps to, and it uses life experience to help create that explanation of events. So if the person's life experience was a parent with just a stomach that reacts badly to bad food, that would be the person's explanation. But if the person's explanation or history was of someone who died of stomach cancer, the brain will use that as a reference to explain stomach pain. Now, once the brain uses that as an explanation, but medical science cannot validate that explanation, the person needs to create a delusion around that self-made reality, which is experience-based and which is an attempt to explain life experience. Now, what happens next is where the delusion can actually advance, where the person can start to believe that all of the doctors are conspiring to, they're all conspiring to let this person die of stomach cancer. For some reason, they all want her dead. That's where it crosses from a non-bizarre delusion, which is that the person may have a condition that medical science is unable to identify. That is a delusion, but it's a non-bizarre delusion because there are conditions that medical science has not in the past been able to diagnose until it was too late. That has happened, so it's not bizarre to believe that that's the case. However, that non-bizarre delusion can cross over and progress into a bizarre delusion if allowed to, where the person will actually start to believe that they're all conspiring to let her die, and they don't want her to find out what's wrong with her because they all just want her to die of stomach cancer. That's a bizarre delusion because it's very unlikely that all of the doctors are working together on some conspiracy to let her die. And it can progress from there. But that is how a secondary delusion can actually go, is based on, to break it down, number one, an explanation of life's events, which is a normal human reaction to experience. The explanation, number two, is based on life experiences. Number three, the delusion may be non-bizarre and will be a delusion, but will to that person explain what's happening, and it can also progress to a bizarre delusion where it starts to become conspiratorial and things like that. Now, somatic delusions are a separate issue, which I want to discuss in a separate video because it's a whole topic in and of itself. But I did want to differentiate between a primary delusion, which, again, like I said, most of it's a chemical-based delusion, an excess of dopamine, serotonin, or whatever the chemical may be, which can be normalized with medication, and then a secondary delusion, which is the attempt to explain life's events. Now, the way out of that delusion, or the clawback, as I've said in my previous video, is to, which I'll elaborate on, because I think, again, that each thing, especially with this subject, each thing just branches off into its own topic. But that the clawback would be to help the person understand how they even arrived at their bizarre delusion, how they were trying to explain what happened to them and how it progressed, and perhaps helping them find alternative explanations for life's events. And one of the ways to actually help someone out of that delusion, which again I would have to elaborate on separately, is to show the person how their explanation is exclusively based on their life's events. For example, I would ask the person, if your parent had liver cancer, would you believe that the abdominal pain was probably liver cancer? And the person would respond, yes. Now, that helps the person gain some insight into the fact that their initial assumption of stomach cancer is only based on their life experience, and had their experience been different, their explanation would be different. And that sort of pops the bubble around the delusion, because the delusion is a bubble. It's a bubble of belief that's very hard to penetrate, and in some cases almost impossible. But that is the pinprick, and most of my videos will be the pinprick into the delusion. We'll pop the bubble, and once the bubble is popped, the ear starts to go out. Now the ear doesn't immediately escape. It pops, it deflates slowly, and sometimes can actually be patched up and may have to be re-popped. But at least the initial pop to that bubble is made. One example would be four children whose father died, and how all four can have a different reaction to the same event. And I'll elaborate on that in the next video. Thank you very much.